When we think of costs, we tend to list obligations, utility bills, payroll, license subscriptions, and equipment leases. But we forget that our own mindset can also be a liability, holding us back from taking steps to seize opportunities and move forward. But fortunately, we can change our perspective if we are willing to look. Welcome to this edition of the eClinicalWorks podcast. I'm Adam Salati, and today we are looking to Kimberly Stahl, who recently took the role of practice administrator at Maryland Endocrine and led a major overhaul of the practice's operations and culture. Kimberly, welcome to the podcast. Thank you so much for being here.
Good to be here.
Kim, tell us a little bit about Maryland Endocrine and where the practice found itself when you were hired.
Okay. It's a private practice or a private endocrinology practice, but there are 10 providers. We have about 45 staff members. And when I came, they were looking to move to a different EMR because they didn't believe that the eClinicalWorks had the capabilities that they were looking for.
How did you find out more about the capabilities of eClinicalWorks and what was possible when you came on? Because you came from other systems. This was your first eCW experience.
Most of it was me asking questions, a million questions. They were probably so tired of me. And then also my eClinicalWorks.com is my best friend. And I get on there every day at work. I get on there at night when I get home just to try to teach myself and to see things that, oh, wow, I didn't know we could do that. eClinicalMobile, we already had that and we didn't even know it. So I turned it on. And that was one of the first things. The doctors were really excited about it. They just didn't know that they even had that capability. So
how did you convince them that staying with eCW was the logical choice? You said they had one foot out the door. How did you make the case?
Well, I said, all the staff is already using, eCW. I said it would be a very easy switch to go to the web version. That could be the first step, kind of a baby step, rather than changing to a completely different EMR, having to close the office, losing revenue, getting everyone trained. Basically, the doctors, as soon as they saw a couple of pieces, starting, they were almost on board. So we started using the web version. They were just ecstatic about that.
Well, it's interesting that you say that even just going to the web version with maybe not even very many new features, just going to the web version made a big difference for them.
Yeah.
Because we do still have a lot of holdouts, other customers that are not quite ready to make that leap. Don't quite know, but it sounds like from your experience, it was a big game changer for your practice. Start with the front office. What were some of the biggest issues you faced there?
So the front staff was not knowledgeable with insurance cards at all. Nobody was actually entering the information. So a lot of times the patient's information was from their last year or 2 years ago. So the claims were getting billed out under the wrong insurance. So that was the main thing at the front desk. They were relying on the billing department for all of that. And they were not getting any money. They were not really collecting copays. They weren't asking patients for balances. Now the front desk is a completely different story. They are on it. They come every day. I collected this much. They're excited about it because they just didn't know, I guess. But now it's like a different practice when you go to the front desk.
So how are you collecting those insurances? How are you getting those into the system? And what are you doing differently now?
Well, so we have a lot of patients on the patient portal now. We really pushed that out. I got some manuals made up. We gave them out. The doctors are telling the patients, please, that's the best way to contact us. You can pay your payment on there. You can, pay before your appointment. So that was a major thing. Plus, we also got kiosks for the waiting room about 2 months ago. And so now the patients, when they come in, they can scan their insurance card right there. Now since we're on version 12, it's automatically, updating in the patient's chart. So they don't even have to actually manually, type it in. So.
And you're also making it easier for patients to actually pay the remaining balance, not just the copay.
Right.
Talk about what you're doing there.
Well, so we have HELO statements now, which is wonderful. Before we were sending out big stacks of envelopes and paper and spending thousands of dollars just to get those out. Now the HELO statements, they go out automatically. I think they're very patient. They're really easy to look at, more so than what they were looking at before. So bringing in that extra revenue from, patients' back balances from their telehealth visit or whatever it was that they haven't paid for the past 4 years.
What were the costs before using the patient statements, and what's it like now that you have it on?
Well, so our mail machine, we were adding like $4,000 to $5,000 a month, if you can believe that. And now we're down to like one every 2 weeks. So we've saved tons with, even just those two little things that you wouldn't think would be very significant, but it makes a big impact.
That is a big impact. And what kind of impact have the electronic statements had on your ability to collect payments?
Now the patients, I think, are more aware when they have an appointment, and they're kind of actually taking a look and asking actually the front desk before they even leave, do I have anything on my account now? And, oh, I just received my statement. And, so they're offering to pay their back payment before that was not happening.
You've also been able to leverage technology to modernize the way you communicate with those patients, not just give them the ability to send money to you. What changes have you made there?
So not very many of our patients were on the patient portal at all. A lot of them didn't even have email addresses in their account. We got some things, got some posters, we got some brochures. We educated the staff, the MAs, the front desk, everybody, billing, the call center especially, to kind of walk the patients through. So now actually when the patient calls, if they're a new patient, the call center actually stays on the phone with them to wait to make sure they get that link to get on the portal, and that they know where, to fill out the forms and everything for their first appointment. So that has changed dramatically, because that's not at all how the workflow was.
What about being able to communicate with patients directly? What about those capabilities?
The SMS, the text messaging, and the web messaging. I think the doctors love it to save them time. It's also saved, with our staff members having to get that. I think the patients are starting to get a lot more comfortable with that back and forth conversations with the doctors.
In the last 6 months or so, I think you've turned on more features than I think anybody has in maybe the past decade. You've turned on things like HELO Pay, HELO statements, insurance verification, electronic appointment reminders. I think the list goes on. What are the indicators that tell you that this transformation has been a success?
Well, one good thing is that we are actually getting a lot of patient payments now. It was amazing. And the one, just for example, the first day that we turned on the electronic statements, we brought in $40,000 just from patient payments, which is astronomical. And now we even have kiosks. We just got those a couple months ago. So it's kind of helped to the front workflow a lot. With the insurance cards, people can scan them in now. So we know that they're getting updated and they're going to be in the chart. Patient payments, their credit card can be on file now. And, the little alert comes up. So they actually are seeing that and paying it. So it's been really good, that part. So
that's excellent. What about reactions from team members, providers, billers, bookkeepers? What have they said about
the
this?
bookkeeper was very happy. The doctor's very happy. The staff is actually kind of excited about all of these changes now. At first they were not, but when they see all these little things coming up that they can now do, they're getting excited about it. So that part's been good.
Well, Kimberly, we thank you so much for your time. And if you're more interested in any of the topics that we've discussed here today, you can visit my.eClinicalWorks.com or speak with your strategic account manager. There's a lot to discuss based on today's episode. And you can also check out our other eClinicalWorks podcasts on Apple Podcasts, YouTube, Spotify. Don't forget to like and subscribe, or even share this with people that you think could benefit from this information. For the eClinicalWorks podcast, I'm Adam Salati, and thanks for watching.